My name is Fuhua Yang. I will talk about the antioxidant combination products that improves the quality of life. Reactive oxygen species are the source of oxidative stress, and there are many different difficult types. Broadly speaking, there are reactive oxidative species, ROS, with higher activity than oxygen, and free radical with unpaired electrons, and some molecular have both features. These are increased by UV, exhaust gas, radiation, tobacco, mental stress, alcohol consumption, and other environmental and lifestyle factors around us. Sorry. And they are also increased by aging, Alzheimer's disease, and lifestyle-related disease such as diabetes, cancer, and autologous sclerosis. Free radicals have an unstable unpaired electrons. Electrons are stable when paired, but unpaired electrons are unstable. Unpaired electrons try to stabilize even by taking electrons from others. Deprived electrons are also unstable, so they take electrons from others as well. So once free radicals are generated, oxidation proceeds up the chain. Elevated oxidative stress show up in the body in the form of poor skin conditions such as increased acne, wrinkles, and blotches, as well as increased fatigue, poor sleep quality, constipation, and stress. This leads to a decrease in quality of life. This was the subject of a paper published in Cell in 2020. The paper reports that sleep deprivation is a factor that increased ROS, and that if it continued, residual amount of ROS accumulate in the gut, leading to death. The long-lasting presence of ROS result in atherosclerosis, various pathologies, cancer, cell membrane damage. This is also why disease increases with age. Oxidative stress and quality of life are closely related. 20S, which we researched and developed, is a patent antioxidant combination supplement for hangover relief that contains 8 ingredients. The product is marketed under the name Symp and has passed all the safety tests required for pharmaceutical products. Oxidative stress is elevated by high dose of alcohol. This is the blood oxidative stress data for mice. The normal value is 100 unit card. After one dose of alcohol, the oxidative stress in the blood was still quite high after 3 days, and after 5 days, the oxidative stress was reduced but still high. The administration of 20S showed that the elevated oxidative stress is suppressed. 20S all reduce ethanol and acetaldehyde in the bloodstream, an effect not seen with any other anti-alcohol supplement on the market in Japan. 20S reduce oxidative stress and relieves the symptom of hangover after alcohol consumption. The effect of SPARIB on acute alcohol intoxication. 6.4 gram per kilogram ethanol, all mice died within 12 hours after ethanol administration. The glucose infusion group survival was better than the ethanol-only group, but all mice died within 48 hours. SPARIB was force-fed 3 times, 13 minutes before alcohol administration and every 12 hours after administration. As a result, no deaths were observed in the mice. Alcohol causes an increased oxidative stress for a prolonged period of time due to its metabolism acetaldehyde. Oxidative stress causes various symptoms after drinking, including hangovers. 20S inhibit oxidative stress after drinking and may reduce various alcohol-related symptoms and death from acute alcohol intoxication. This is 20X. It is another patented antioxidant combination supplement consisting of 8 ingredients. The results of clinical trials have already shown effective in preventing dementia in mild cognitive impairment. 20x lower blood oxidative stress in healthy individuals after 2-4 weeks of intake. Most people showed lower blood oxidative stress than before taking 20x. Here is the defecation status of healthy individual. The change before and after taking 20x for 4 weeks were examined. A is for males and B is for females. Results show that increased number of both male and female reported having a pleasant bowel movement after taking 20x compared to before. In addition, in terms of stool condition, normal stool increased after taking 20x. The improvement in stool condition was more pronounced in females than in males. In addition to this, here are the results of the questionnaire survey on acne. For the question, did your acne depress with 20x? 96% of the response indicated that it was effective. Other responses included skin whitening and spots disappearing. It also has impact on physical changes. Body is less tired and recover from fatigue faster. It's 80%. Skin is firmer and more supple with no spot wrinkle. or dullness is 80%. Skin is less dry, less itch, and more moist, 75%. Better morning wake up and less depressed mood, 75%, and slept deeper and wake up better in the morning, 70%. All responses show an improvement of around 80%. The next is 20 mitochondrial. It has 7 ingredients added to the 8 ingredient of 20X. All have a passed safety test. Chronic fatigue syndrome is a disease with no established cure and is designated as an intractable disease. It causes several fatigue and malaise and interferes with daily life. Patients diagnosed with chronic fatigue syndrome are asked to take 20 mitochondrial. This graph shows how the impact of fatigue on daily life change before and after taking 20 mitochondrial. Before taking, there were no respondents who answered that fatigue did not affect them. After taking 20 mitochondrial, almost 10% said fatigue did not affect them. The blue area indicating less impact of the fatigue increased. Similarly, the effect of sleep disturbance on daily life was surveyed. Before taking 20 mitochondrial, almost all respondents had some sleep disturbance. After taking 20 mitochondrial, the number of respondents who said they were less affected increased to a little less than half, indicating that the quality of sleep was considerably improved. Conclusion: the antioxidant combination 20 was found to improve quality of life by lowering blood oxidative stress, improving appearance conditions such as acne and wrinkles, improve physical and mental conditions such as fatigue and depression, and improve sleep quality. 20 can improve quality of life. Thank you very much for your attention.